Mom's Fit Life, and I recently saw a question come up in a mom's Facebook post that stopped me in my tracks. Someone had asked if anyone had ever had their tailbone removed because 4 years of miserable pain following childbirth, sitting even for a few minutes still felt unbearable. They listed everything they've tried: injections, massage, acupuncture, PT, stretching, heat, ice, you name it. And honestly, I've heard versions of this all the time. It did catch me off guard a lot, but if you have been in pain for years after having a baby, but you can't seem to be given a real answer, I promise it's not in your head. You're not broken, you just haven't had someone look at the right thing yet. Okay? When it comes to tailbone pain, let's break it down a little bit. We'll focus mostly on that today. Okay, so what actually causes tailbone pain after birth? Some of this can also start happening in pregnancy, okay? Yes, sometimes the tailbone itself is actually fractured or injured or bruised, maybe slightly shifted during delivery, but often the issue is bigger than the tailbone itself, okay? In a lot of cases, the tailbone is getting compressed or pulled because of how the pelvis, the spine, and the pelvic floor are working or not working together. And they need to be in unison to have a good, healthy, functional tailbone as well. So you might have tension in your pelvic floor, and it might be constantly tugging on the tailbone. You might be sitting or standing in a way that puts a lot of pressure on the coccyx by tilting the pelvis under more. Or maybe you have an SI joint or sacrum that isn't moving well, and so the tailbone is getting stuck, which can result in some pain. Okay, most people have never really been taught how to identify or correct any of this. And even the greatest PTs sometimes can miss the connection, especially if they're not trained in postpartum biomechanics or pelvic floor work. You know, another soapbox would be depending on what insurance says too. Okay, so now what can you do about it today? If you've done the traditional treatments and nothing's helped, I recommend zooming out and kind of taking a bigger peek at your full body. So we want to look at things like, how is your pelvic floor coordinating with your breath and core? Is it weak? Is it tight? Is it in constant tension? Can you relax it with your inhale and lift it with your exhale? You know, you want to think about whether your posture is keeping pressure on your tailbone. And if you're having any asymmetries that are keeping you in patterns that developed in birth that have never been addressed or fixed later. Okay, sometimes the most effective work about resetting your body and how it moves is not just treating the painful spot. Sometimes it's what's above or what's below, and oftentimes that pain isn't actually where it's at. So I'm going to show you a way today that we can kind of help relax the pelvic floor, maybe get a little bit of relief temporarily in the area, and maybe free up the tailbone just a little bit. But again, this is going to be kind of something that you can do for now. And we can then take a look at a full body assessment and see what else might be affecting how your tailbone is moving and feeling. Okay, so if you notice, I am on a nice firm like dining room type chair, and I have a trigger point ball. Okay, a yoga ball works, a lacrosse ball is good as well. And you're gonna come to the edge of the chair and we're gonna sit on the ball. Now, what I want you to do is I want you to place the ball between your sit bone and your tailbone. So there's going to be a little bit of a fleshy spot right inside that sit bone and right between your tailbone and sit bone. And you might even need to kind of like lift your butt cheek up a little bit And you're just going to place that ball right inside there. This might feel really tense and tight at first, could be pretty painful depending on how tight you are here, okay? But slowly over time, it should get less and less painful, and we're working it just at first, relaxing and melting over the ball. And you can kind of adjust it, you know, find those really tender spots in that pelvic floor. Again, you don't want to be sitting on a bony structure, so make sure the ball is between your bony structures. Again, just let that pelvic floor, imagine it melting down over the ball. Okay, as it starts to feel better, you can kind of move around on the ball, kind of little circles. Okay, of course, you're going to do both sides. You're going to come as close to your back of your leg as you can, and as far back of your body as you can. Okay, again, working both sides. And remember what I said is, you know, so for me on this side is a little more tender, okay? That happens too. That's something to note and pay attention to. But remember what I said, that this is a good way to temporarily let those muscles relax and stuff. But we need to figure out if this is super tender and tight. So, you know, I'm going to take a look and go, why is my left side so tight? What am I doing on the left that's creating so much tension versus the right? Okay, why am I in so much pain? Why is it impossible for me to sit on the ball right now? What makes it so hard and hurt so bad? Because ultimately we need to release that in order for this to be something that is long term. Okay, so you don't need to rush into surgery. You know, I do think that sometimes that's once you feel like you've exhausted everything, so hopefully that's not your first go-to. But it's not uncommon to have tailbone pain and have it not go away without proper treatment. Pelvic floor PT is a great way to see what's happening internally and help release that pelvic floor and see if we can't get that tailbone to move and function a little bit better. Okay. If you come see me, we do a full body assessment. We talk about the symptoms. We talk about what makes it hurt or not hurt. And then we kind of address what I see and what you're feeling. And we go from there. And long term, we can get that tailbone to calm down, feel better, and not have so much pain when you're sitting. Okay, feel free to reach out with any questions, and I look forward to next time.